So now is the moment you've all been waiting for. Are you ready? I would like you to welcome to the stage, Donum.
Good afternoon. I am Kashvi Gupta, and with Koska, Amanda, Bruna, and Rebecca, we are Team Donum. As an intern doctor in the cardiology intensive care unit at Henry Ford Hospital in Detroit, my first patient was Kelly. Kelly was a 19-year-old girl, healthy, happy girl who got admitted with a sudden heart attack. She was diagnosed with a rare condition of the heart for which the only treatment option was a heart transplant. Unfortunately, this is not an unusual story. There are 115,000 people on the wait list for an organ, 22 of whom die each day waiting. That is about 8,000 people dying each year waiting for an organ because there aren't enough people signing up to be an organ donor at the DMV. This is what it looks and feels like to be at the DMV. It is certainly not the right place to be asking people to register to be an organ donor. In addition, between 1983 to 2014, there has been a 47% decline in American teenagers getting a driving license. So we did a survey to understand how the situation was on our campus. Among 651 faculty, students, and staff who were interviewed, 64% were not asked at the DMV or the Secretary of State office to register as an organ donor, or did not have enough information at the time. In a national survey that was conducted, 95% of Americans were found to support organ donation, but only 53% were found to be registered donors. To bridge this gap, we developed a simple solution, Donum. Donum prompts individuals at additional time points to register as an organ donor. In phase 1, our primary users will be matriculated students at colleges and universities. Freshmen at 18 years of age are happy, they're excited, they're making important life decisions, they're entering a new community. They are at the right age to be asked to register as an organ donor. In fall 2017, there were 20.4 million students entering universities. That is 10,000 students at the University of Michigan itself. In phase 2, we will extend this opportunity for new employees joining a company or organization. So how is it going to work? So when students register for orientation, they will be prompted to register as an organ donor and redirected to our webpage. On our webpage, they can register to be an organ donor, but also learn more about the process of organ donation. By breaking down dense scientific information into infographics, we enable them to make informed decisions. When they feel confident to register, their name will be added to a national database that is maintained by Donate Life America. We will encourage all our users to share their pledges using our templates on Facebook or email, thereby starting a conversation around the topic of organ donation. We built our model by receiving valuable feedback from our primary users, as well as experts in the field, which included faculty, staff, doctors, transplant coordinators, tech companies, and NGOs. Dr. Andrew Cameron, who is the chief of transplant surgery at Johns Hopkins, provided us with immensely valuable feedback and shared with us his experiences of developing web platforms for increasing donation rates. In addition, we connected with Sheryl Sandberg at Facebook and had a conference call with Facebook's health team to understand the social networking aspect of organ donation. From them, we took inspiration for developing the next important feature of our platform. So we at Donum understand that organ donation is a profound emotional experience for both the organ transplant recipient family and the donor families. On our platform, we encourage donor families and recipient families to log in and create a circle of social support. We encourage them to share their stories on our front page, thereby inspiring people to become organ donors. This new feature that we wanted to add, we validated it by talking to people who have worked in the field of organ donation. For example, Christine at Apple, who said this community building aspect to organ donation is currently lacking and is most needed in the world. By talking to Tim and Jennifer at Donate Life America and Gift of Life Michigan, who will be our potential collaborators, they made us understand that this relationship that we are building goes beyond just asking people to register as an organ donor. On our timeline, in fall 2018, we will run a pilot at the School of Public Health, University of Michigan. In 2019, we will launch our first full wave at all the 19 schools and colleges at the University of Michigan. By 2020, we will expand to all the universities and community colleges in the United States. We will also launch our first pilot in India as we have obtained permission to use the national database. By 2022, we will expand this opportunity for companies and organizations. With a 20% increase in organ registrations through Donum, more than 4,000 lives can be saved. So Donum is a nonprofit. We believe in minimum investment with maximum impact. The seed funding that we will receive through competitions such as Innovation in Action and university grants will be used for building the web platform. In addition, we will obtain partnerships with NGOs, CSR funds, and fundraising for making it sustainable. We will also follow an open source economy that is collaborating with NGOs and building on existing research and technologies. I think it has been about 10 minutes since we have been in this room together. Well, one more person has been added to the wait list for an organ. One person can save 8 lives. So if a person who dies is not an organ donor, he takes more than 1 life with him. Together, as a team, we represent 5 schools at the University of Michigan and 4 countries. Please join us in Donum's pursuit to revolutionize organ donation. Thank you.
Great job. I think as I mentioned this morning, your level of market research and testing and getting feedback and validating the need, the approach is really remarkable and very, very well done. I also think, as I told you this morning, your presentation is very professional and you guys do a great job. I do want to come back to the issue of sustainability in the context of a nonprofit and in the context of the kind of revenue generation. As I saw it, there's a couple of $10,000 awards and then a $6,000 annual funds and so on. I wonder if you think that level of funding is sustainable, or if there are ways to leverage what is a spectacular idea, very leverageable idea with some of the existing state and national organizations and how you do that.
Absolutely. So something else we've talked about in addition to the strategies we talked about this morning is that we would be thrilled to actually have this be incorporated to Donate Life America as an exit strategy. Our goal is to increase the number of registrants of organs, not necessarily to be running a business for many, many years. And so if we can show that our platform is getting more people to sign up, we think that Donate Life America would be very interested in incorporating that into their current efforts.
Question for you. So I think there's some just maybe unfamiliarity or uncertainty with organ donations in general. There's religious concerns with some folks. There's maybe, I don't know, medical or handling concerns. How are you going to work with experts to provide that sort of insight and education to your consumers?
Yeah, that's a great question. So there has been a lot of work which has been done in this area, and a few things that we have learned in our journey is that, one, we are going to provide people information in the language that they want to see the information is, which is currently lacking. Like if you're approaching people who want to see it in Spanish because they understand it better, so we'll be, approaching it that way, and also like working with specific organizations who cater to, like, say, MOTEP in Detroit works with African Americans. So we will work with them to see what has helped them, and kind of like develop these partnerships with each organization, and see and learn from them like what has worked and what has not. So.
Okay. In addition to just getting more folks to sign up to donate organs, if you had to pick, say, at least 2 other measures of success, what would they be, and how would you actually go about measuring them?
So 2 other features that we would like to incorporate, like in addition. So the first one would be like to build this community, actually. Really, I feel that is really lacking. When we have spoken to people who have received organs, and they said, if we had like someone who could talk to us of the same age group, So we can measure this easily because of the number of people who will be logging on with us and the number of users and circles which are being developed. Another thing, in addition to having people really just sign up, is people who don't sign up, who refuse to sign up, sending them a reminder email after 6 months with information that helps them sign up, like converting these people. I think that would be the biggest success that we can have through this platform.
And one other thought on that, I think, not quite sure how we'd measure it, we'll think about this, but I think a measure of success for us would be if organ donor registration isn't automatically connected with the DMV in people's minds. So if we can move the status quo to, it's part of the culture to sign up at school registration or a new job orientation, or we're going to explore other avenues. But if we can change that status quo, I think we would feel successful.
Great answer. So congratulations on becoming a finalist. That being said, I'm interested in the team makeup and a little bit more about the concept in India that you mentioned, and what was everybody's responsibility or contribution to Donum?
Sure. So Bruna is an M design student at STAMPS, and she helped us overall give the design and design the wireframes, give the overall look to the presentation. Koska helped us in designing the model and understanding what the sustainability angle of this was. Amanda is a biology, health, and society undergrad student at LSNA, and she helped us with her language and communication skills. I think she's done most of the editing on the slides in terms of what's being presented, all the punchlines. Rebecca is an MD MBA student at the Medical School and Ross School of Business, and she really helped us understand the policies and how organ donation has evolved, and what are the medical aspects that we should be aware of. And I myself, I've graduated from medical school in India, and I'm currently pursuing my MPH at the School of Public Health. I have assisted in heart transplant surgeries before. I have spoken to a lot of people who have gone through this experience, and I think that was very valuable.
Thank you.
Thank you.